Hey everyone, welcome back to the podcast. I'm Emma, and as always, I've got Jake here with me today. Jake, how are you doing?
I'm doing really well, thanks. Actually, I just got back from a doctor's appointment this morning, so I'm feeling very much in the healthcare headspace right now.
Oh, that's perfect timing then, because today we are talking all about healthcare and medical English. And Jake, I feel like this is one of those topics that people always say, I'll study this later, and then they find themselves in a clinic somewhere completely lost.
Exactly. And the thing is, healthcare vocabulary is so important because the stakes are high, meaning the consequences really matter. You can't just guess your way through a conversation with a doctor. Well, you could try, but I wouldn't recommend it.
No, please don't. So today we want to help you feel confident if you ever need to visit a doctor, a hospital, or even just talk about health in general in English. Jake, let's start from the very beginning. What's the first thing that usually happens when someone needs medical help?
So the first step for most people is making an appointment. You call a clinic or a doctor's office and you schedule a time to come in. And even that phone call can feel nerve-wracking, a little scary and stressful if you're not used to the language.
Right, and there are some really specific phrases people use on those calls. Like you'd say something like, I'd like to make an appointment to see a doctor, or I'd like to schedule a visit. You don't just say, I want to come. It sounds a bit too direct.
Yeah, and they'll usually ask you a few questions. Things like, what's the reason for your visit? Or what are your symptoms? And symptoms, that's a key word. Symptoms are the signs of an illness that you feel or notice. So a headache, a fever, a sore throat, those are all symptoms.
That's such a good word to know. And it's interesting because in everyday conversation, people often say, I have a headache. But at the doctor's office, you might say, I've been experiencing headaches for 3 days. It sounds more formal and gives more information.
Exactly. Doctors love detail. They want to know when it started, how bad it is, whether it's getting better or worse. There's actually a classic set of questions doctors use to understand pain. One of them is asking you to rate your pain on a scale of 1 to 10.
Oh yes, the pain scale. I remember the first time a doctor asked me that, I had no idea what to say. I was like, is a 5 bad? Is it not bad enough?
It's weirdly philosophical, right? Like, is a 5 moderate? Because for some people, a 5 is crying on the floor, and for others, it's barely noticeable.
So for our listeners, if a doctor asks, on a scale of 1 to 10, how would you rate your pain? 1 means almost no pain, and 10 means the worst pain you can imagine. And moderate means somewhere in the middle, not too severe, not too mild.
And that word severe, S-E-V-E-R-E, it means very serious or very intense. You'll hear it a lot in medical contexts. Severe pain, severe symptoms, a severe reaction. It basically signals that something is quite bad.
Good one. Now let's talk about the people you actually meet at a medical facility, because there are so many different roles and titles, and it can get confusing.
Yeah, so the most common one is a general practitioner, which is often shortened to GP. This is your regular everyday doctor, the one you see for most common health issues, colds, checkups, minor injuries. They're your first point of contact.
And then from there, a GP might refer you to a specialist. To refer means to send you to someone else, someone who has more specific expertise in a certain area. So if your GP thinks there might be a problem with your heart, they'd refer you to a cardiologist.
Right. A cardiologist deals with the heart. A dermatologist deals with skin. A neurologist deals with the nervous system, the brain, the spinal cord, the nerves. All those ologist words basically mean a doctor who specializes in a particular area.
I love that pattern. Once you know that ologist means a specialist in something, a lot of medical vocabulary suddenly starts making sense. It's like a little code.
It really is. And then you've also got nurses, who are incredibly important. They often spend more time with patients than doctors do. And a patient, by the way, is the person receiving medical care. You become a patient the moment you're being treated.
Right, and there are also pharmacists, the people who work in a pharmacy or drugstore and prepare and give out medications. They're actually a really underused resource. Like you can walk into a pharmacy and ask a pharmacist for advice on minor health issues without even seeing a doctor.
Totally. Pharmacists are fantastic, and in some countries they can even recommend over-the-counter medication, meaning drugs you can buy without a prescription.
A prescription is a written order from a doctor that allows you to get certain medications.
So you've got over-the-counter, which anyone can buy, and then prescription medication, which you need a doctor's note for. That distinction, that difference, is really important to understand.
And the note itself is literally called a prescription. The doctor writes it, you take it to the pharmacy, and they fill it, meaning they prepare the medication for you. Fill a prescription is a very common phrasal verb in medical English.
Oh, that's a great one. Fill a prescription. And along those same lines, if you take medication regularly, you might need to refill it, meaning get more of the same medication when you run out.
Exactly. I need to refill my prescription is something you'd say when your medication is almost gone and you need more. Very practical phrase.
Okay, let's shift a little. Let's talk about what actually happens during a medical appointment, because I think a lot of learners feel nervous about the actual conversation inside the exam room.
Sure. So when you arrive, you'll usually check in at the front desk, meaning you tell the receptionist you've arrived. They might ask for your insurance information, your ID, and they'll have you fill out some paperwork, like a patient form with your medical history.
And medical history is such an important concept. It basically means a record of all the health issues, illnesses, surgeries, and medications you've had in the past. Doctors ask about your history to understand your health overall.
They'll ask things like, do you have any allergies? Meaning, are there any substances that cause a bad reaction in your body? Are you on any current medications? Meaning, are you taking any medicines right now? Do you have any chronic conditions?
And chronic, that's a really important word. Chronic means something that is long-lasting or ongoing. The opposite would be acute, which means something that came on suddenly and is short-term. So a chronic condition like diabetes or asthma stays with you for a long time, while an acute illness like a cold usually goes away.
That distinction really matters, and patients with chronic conditions often have ongoing care. They see their doctor regularly, not just when something goes wrong. It's more about managing the condition over time.
Speaking of managing, let's talk about some common things that happen during the physical examination, the actual hands-on part where the doctor checks your body. Jake, what kinds of things do doctors typically check?
So a doctor might take your vital signs first. Vital signs are the basic measurements that show how your body is functioning. Things like your blood pressure, your heart rate, how fast your heart is beating, your temperature, and your oxygen levels.
And blood pressure is one of those things that almost everyone gets checked. But a lot of people don't really understand what the numbers mean. You've probably heard something like 120/80.
Right. So blood pressure is measured with two numbers. The top number is called systolic pressure. That's the pressure when your heart beats. The bottom number is diastolic. That's the pressure when your heart rests between beats. And 120/80 is generally considered normal or healthy.
If your blood pressure is too high, that's called hypertension, and too low is hypotension. And again, you can see those prefixes. Hyper means too much or over, hypo means too little or under. Very useful patterns in medical vocabulary.
Absolutely. And then the doctor might listen to your lungs and heart with a stethoscope. That's the device with the two earpieces and a round piece that goes on your chest. Classic doctor image.
Yes, very iconic. And they might press on your abdomen, that's your stomach area, to check for tenderness. Tenderness means pain when pressure is applied. So if the doctor pushes on your belly and it hurts, you'd say, that's tender there.
And a doctor might also look into your eyes, ears, and throat. For the throat, they'll ask you to open your mouth and say, ah. And that, honestly, is probably one of the first things even beginners learn about the doctor's office.
True. Say ah might be the most universally known doctor phrase. Okay, so after all the checking and examining, the doctor usually gives you a diagnosis. Jake, explain that one.
So a diagnosis is the doctor's conclusion about what is wrong with you. Like, after looking at all your symptoms and test results, the doctor says, you have bronchitis, or this looks like a sprained ankle. That conclusion, that identification of the problem, is the diagnosis.
And the process of reaching that diagnosis often involves tests. Blood tests, urine tests, X-rays, MRIs. All of these help the doctor gather more information. And an MRI, by the way, stands for magnetic resonance imaging. It's a scan that gives a very detailed picture of the inside of your body.
And X-rays are great for looking at bones. So if you fall and hurt your wrist, The doctor might send you to get an x-ray to see if anything is broken or fractured. A fracture is a break in a bone, though some fractures are minor cracks and some are more serious.
So a broken bone and a fractured bone are basically the same thing, just that fracture is the more medical term. Good to know if you're ever in that situation, which hopefully you won't be.
Fingers crossed. And after the diagnosis, the doctor will recommend a treatment. Treatment is anything done to help with the illness or injury. It could be medication, physical therapy, rest, surgery. It really depends on the condition.
And surgery is worth mentioning. Surgery is when a doctor operates on your body, physically cuts and works inside to fix a problem. It's performed in an operating room by a surgeon who is a doctor who specializes in performing operations.
And surgery can be anything from a minor procedure, like removing a mole, to a major operation like open heart surgery. Minor procedures are usually outpatient, meaning you go home the same day. Major surgeries might require you to be admitted to the hospital, meaning you stay overnight or longer.
The word admitted is interesting. To be admitted to the hospital means to officially become a patient who stays there, and when you leave, you're discharged. The patient was discharged on Friday means they were allowed to leave and go home.
Great pair of words, admitted and discharged. And while you're in the hospital, the people taking care of you around the clock are often the nurses. I really think nurses don't get enough credit. They're doing so much.
Absolutely. And let's not forget emergency situations, because sometimes you don't have time to schedule an appointment. Sometimes you need help right now.
Right, and in that case, you go to the emergency room, often called the ER. This is the part of the hospital that handles urgent, serious situations. Car accidents, heart attacks, severe allergic reactions, those all go to the ER.
And a word you'll hear a lot in emergency settings is triage, T-R-I-A-G. It's a process where medical staff quickly assess, meaning evaluate or check, how serious each patient's condition is, and then they decide who needs to be treated first.
So if you walk in with a broken finger, you might wait a long time because there are people with more urgent situations. It's not that you don't matter, it's just that resources go where they're needed most immediately.
Exactly. And the word urgent means requiring immediate action, something that can't wait. This is urgent means you need help right now, not tomorrow.
And on the topic of emergencies, it's worth knowing how to describe an emergency in English. Things like, he's not breathing, she lost consciousness, meaning she fainted or passed out, she's unresponsive, or there's a lot of bleeding. These are sentences that could genuinely save a life.
Really important. And call an ambulance is a phrase everyone should know. An ambulance is the emergency vehicle, the one with the sirens, that transports patients to the hospital quickly. In most countries, you call a specific emergency number, like 911 in the US, 999 in the UK, or 112 in many European countries.
And if someone is having a heart attack, you want to be able to say that clearly. A heart attack is when blood flow to the heart is suddenly blocked. Symptoms include chest pain, shortness of breath, meaning difficulty breathing, and pain that may spread to the arm or jaw.
Shortness of breath is such a useful phrase. It doesn't mean your breath is short in size. It means you're struggling to breathe. You can't get enough air. And it comes up a lot in medical contexts, not just for heart attacks, but also for asthma, anxiety, and other conditions.
Another condition worth mentioning is stroke. A stroke is when blood flow to part of the brain is cut off. The signs include sudden numbness or weakness on one side of the body, confusion, trouble speaking, or a drooping face. There's actually an acronym, FAST, that helps people remember the signs.
Oh, yes. F stands for face. Is one side drooping? A stands for arms. Can they raise both arms? S stands for speech. Is their speech slurred or strange? And T stands for time. Time to call for help immediately. It's a really clever way to remember it.
Slurred speech, by the way, means speech that is unclear, like the words are running together and hard to understand. It's one of the key warning signs. And with strokes, time is absolutely critical. The faster you get treatment, the better the outcome.
Okay, let's come back down from emergencies and talk about something a lot of people deal with regularly, mental health. Because mental health is absolutely part of overall health, and the language around it has really evolved in recent years.
So much. And I think one of the most important things for learners to know is that it's completely normal and acceptable to talk about mental health in English, especially in professional or medical settings. People say things like, "I've been feeling anxious lately," or "I've been struggling with my mood."
Anxiety is the feeling of worry, nervousness, or unease, often about something uncertain or upcoming. And depression is more than just feeling sad. Clinically, it's a persistent, meaning ongoing and long-lasting, low mood that affects your ability to function day to day.
And if you go see a mental health professional, like a therapist or a psychologist, they might talk about things like coping mechanisms. A coping mechanism is a strategy you use to deal with stress or difficult emotions. Some are healthy, like exercise or journaling. Some are less helpful.
A therapist and a psychologist are slightly different, by the way. A psychologist typically has a doctorate degree and can diagnose mental health conditions. A therapist is a broader term for anyone who provides talk therapy. And a psychiatrist is a medical doctor who can also prescribe medication for mental health conditions.
That's a really helpful breakdown. And talk therapy, sometimes called psychotherapy, is basically having structured conversations with a professional to work through emotional or psychological issues. It sounds simple, but it can be genuinely life-changing.
It really can, and I think the phrase seeking help is important. To seek help means to actively look for support or treatment. It takes courage, and it's a phrase that carries a lot of positive weight in English. She sought help for her anxiety. That's a sentence that implies strength, not weakness.
Well said. Now, let's quickly touch on something that comes up a lot, health insurance. Because in many English-speaking countries, healthcare isn't free, and insurance is a huge part of the process.
Right. Health insurance is a system where you pay a regular fee, called a premium, and in return, the insurance company helps cover your medical costs. So if you need surgery or tests, you're not paying the full amount out of pocket.
And out of pocket is a really common phrase. It means money you pay yourself, not covered by insurance. So you might hear, "My insurance covered most of it, but I still had to pay $200 out of pocket."
There's also a term called copay, short for copayment. That's a fixed amount you pay each time you visit a doctor or pick up medication, even when you have insurance. Like, my copay for a doctor's visit is $30.
And a deductible is the amount you need to pay yourself before your insurance starts covering costs. So if your deductible is $1,000, you pay the first $1,000 of medical bills, and then insurance kicks in, meaning it starts paying.
Insurance vocabulary is genuinely complex, even for native speakers. So don't feel bad if it takes a while to wrap your head around it, meaning fully understand it. It's confusing for everyone.
Honestly, yes. I've been speaking English my whole life, and insurance paperwork still makes my head spin sometimes.
Same. Okay, let's do something practical. Let's walk through some really useful phrases that our listeners can actually memorize and use. Jake, what are some of your top phrases for a doctor's visit?
Okay, so a few essentials. I've been having this pain for about 3 days. That tells the doctor when it started. The pain is worse when I move. That describes what affects it. I'm allergic to penicillin. Penicillin is a common antibiotic. An allergy to it is important to mention. Can you explain that again, please? Never be embarrassed to ask for clarification.
I love that last one. Can you explain that again? Or could you write that down for me? Are both completely acceptable things to say to a doctor. Good communication is part of good medical care.
And what are my options is a great phrase too. It means you want to know the different possible treatments or paths forward. It shows that you're engaged in your own healthcare, which doctors generally appreciate.
Another one I love is this something I should be worried about? It sounds casual, but it directly asks the doctor to assess the seriousness. Sometimes you just need to hear, "No, this is totally normal," or "Actually, we should keep an eye on it."
Keep an eye on it. That's a nice idiom. It means to monitor something, to watch it over time to see if it changes. A doctor might say, "Let's keep an eye on that mole and see if it changes shape or size."
And if you don't understand a medical term, you can say, "I'm not familiar with that term. Could you explain what that means?" Doctors are generally very happy to explain things in simpler language if you ask.
Absolutely. And one more very important phrase. I'd like a second opinion. This means you want to consult another doctor to confirm or question the first doctor's diagnosis. It's completely your right as a patient. and most doctors won't take offense, meaning they won't be upset or insulted by it.
Wonderful. I think we've covered so much today. Jake, if you had to give our listeners just one piece of advice about medical English, what would it be?
I think it would be, don't be afraid to speak up. In a medical setting, your voice matters. If you don't understand something, ask. If something doesn't feel right, say so. And if you need more time to process what the doctor is telling you, ask them to slow down. Your health is worth that conversation.
Beautifully said. And from my side, I'd say learn the vocabulary before you need it. Don't wait until you're sick or scared to start learning these words. Read about health topics in English when you're feeling well and relaxed, and the words will come much more naturally when it matters.
That's such practical advice. And honestly, even just listening to this episode is a great start. You've been hearing medical vocabulary in context, in a real conversation, and that's one of the best ways to absorb it.
Exactly. And if any words or phrases today felt new or tricky, we really encourage you to go back and listen again. You'll be surprised how much more you catch the second time around, or even the third.
True. And don't forget, making mistakes is part of the learning process. Even if you get a word wrong at the doctor's office, most medical professionals are very patient. No pun intended.
Very smooth, Jake. Very smooth. All right, everyone, that is it for today's episode. Thank you so much for spending this time with us. I hope you feel a little more prepared and a lot more confident when it comes to talking about health in English.
Take care of yourselves out there. And remember, when it comes to your health, don't put it off. In English, we say, don't put it off, meaning don't delay or postpone. If something feels wrong, get it checked.
Great note to end on. Thank you, Jake. Always a pleasure.
Always. See y'all next time.
Bye, everyone, and stay healthy.